I got home from work one day, Angela asked me if there was any yellow in her eyes. At first, did not notice anything. But a couple of hours later, looking into Angela's eyes, she basically said, I basically said, yes, we see yellow in your eyes. So back to the doctors we went. The doctor told Angela that she better get to the hospital right away.
This is my mom and I. Her name is Angela Cuilla. She had stage 4 ampullary adenocarcinoma cancer. The doctors treated for pancreatic cancer. She was given 3 different types of chemo treatments.
Leading up, it was May 2012 when Angela first sustained problems in her belly area, in her abdomen area with aches and pains after eating. She took pills for it, basically thinking it was acid reflux. So when Angela first went to the doctors, that's what they gave her, pills for the acid reflux.
I sat down with Lauren Deans, who is a registered nurse at Loyalist College, to talk about cancer and chemotherapy treatments, as well as what chemotherapy does to the patient's body. This is what she had to say.
The cell that's messed up, okay? And so this cell, either what happens, it can start to duplicate huge, small, and then gets bigger and bigger, so it starts to push out the good cells and the good organs in the body. With like heart disease or lung cancer, it's smoking increases your chances. They're cytotoxic, so the antimetabolite's going to attack that. But on the other hand, too, what it also will attack is your hair cells.
We got scheduled for what was called an ERCP. It's one treatment every 2 weeks. Angela had treatment for about 8 weeks, and then we had a CT scan done, and chemo did not work. We tried clinical trials, but denied everything. We tried radiation, that would not work. We went as far as Hamilton to get some radiation done. They could not do it because of the size of her tumor. She was terminal right from day one, which meant she knew she was going to die. The first thing she said is, I have 3 boys. So I tried to stay as strong as possible. We only told our boys as much as they needed to know because we didn't want them to harp on what was going to happen. But we kept positive, knowing that Angela knew what the outcome was, but the only problem was we didn't know when. So we did what we could. We went, we did the bucket list, and that's what we wanted. She succumbed to her disease, again, April 4th, 2014, but through the whole deal, I would not change a thing. At first, they gave her stuff for acid reflux. They thought maybe it was something like that. But again, when the jaundice came, we knew it was something a little bit more serious.